legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, April 12th. I'm TMA's Brent Anir. With just 7 weeks left, things are moving quickly at the Capitol. Topping our news this week, protecting patients' choice of physician, another step towards silencing silent PPOs, should pharmacists give shots to children? And up first, keeping TMB strong. This week, TMA spoke out against a bill that it says would allow bullying and weaken the Texas Medical Board. Senate Bill 1193 would require the board to provide a copy of the entire complaint against a physician and list the accuser and all physician reviewers who would examine the case. Dr. Gary Floyd, a past chair of TMA's Council on Legislation, told the Senate Jurisprudence Committee that this bill would weaken the peer review process. He also said it could allow bad doctors to bully and intimidate whoever filed what might well be a valid complaint against a physician. And it also subjects the peer review physicians to threat of intimidation. All of this would undermine the board's ability to protect patients.
You know, at TMA for over 150 years, we have vowed that we would practice sound ethical medicine and protect patient safety. And we've never varied from that. It's very important that any observation that would threaten patient safety could be reported in a manner that whoever's complaining, be that patient, nurse, colleague, other physician, a peer review committee of a hospital, they need to be assured that they won't have repercussions, that there won't be any type of retaliation, any type of harassment, any type of bullying. It kind of goes along with the lay concept of a whistleblower protection.
He said if passed, this bill would undo progress from last session when the legislature passed a TMA-supported bill that outlawed anonymous complaints. Tuesday, Dr. Floyd also testified against a bill that he called a solution looking for a problem. It would allow pharmacists to vaccinate children who are between the ages of 7 and 13 years old instead of the kids seeing their own doctors. He told the Senate Health and Human Services Committee that by targeting that age group, SB 1013 would undermine the medical home. He explained that children in that age group see their doctors for school-required shots, and it's in those visits that physicians often catch bigger health issues, from type 2 diabetes to depression. With Texas's good immunization rates among these children, he said it's unnecessary for pharmacists to provide the shots. Instead, it could potentially allow a serious issue to go unchecked. TMA wants patients who rely on Medicaid or any state government health plan to have the flexibility they need to see a physician of their choice. That's what Dr. Russell Kridel, the Harris County Medical Society president, told the House Select Committee on Federalism and Fiscal Responsibility this week. He testified in support of House Joint Resolution 109 by Representative Jody Laubenberg. Under this proposed constitutional amendment, patients could see whatever doctor they choose. The patient could apply the funds the government allows for a procedure toward the doctor of their choice and pay out of pocket for any difference there may be. This way, he said, patients get more choices and doctors are not forced to accept Medicaid contracts, potentially forcing them to see patients at a loss, yet they can still care for those patients. It's a win-win situation.
Physicians are small businessmen. They need to be treated just like all the other small businesses in Texas, given the flexibility to keep their doors open. Costs for doctors are different depending upon their environment. We don't want to coerce them into being into a government system that makes them go bankrupt, as many doctors have had to go. We want to increase access to care, not decrease it. All this does is allow patients to have a greater choice and allow them to seek the doctor that they want to for their care.
If the legislature passes the resolution, Texans would need to vote on and pass it as well. 11 other states have passed a similar measure. Another big step towards silencing silent PPOs this week. The Senate State Affairs Committee passed SB 822 by Senator Charles Schwertner, a TMA member physician. Dr. Don Buckingham of Austin testified in favor of the bill. It would regulate silent PPOs. The companies are networks that sell, lease, or share physician discounts without the physician's knowledge or consent. The House Insurance Committee approved the House version of the bill last week. Next stop is passage on the House and Senate floors. That's all of our time for now. I'm Brent Anir with TMA. Thanks so much for watching, and please join us again next week for TMA's Legislative News Hotline.